Thank you for being here.
Thank you very much.
So, Stephanie, how long have you been practicing acupuncture?
I've been practicing for 3 years now.
Wow. Oh, and I see that you brought some tools of your trade. What do we have here?
I'm going to do a demonstration for acupuncture.
Okay.
If you'd like to give me your arm.
Okay.
Okay.
Sure.
So we're going to do 3 points on your arm. Okay. 1 on your hand, 1 on your wrist, and 1 on your elbow. Okay. So first, let me clean the area because it will penetrate the skin.
Okay.
So it does need to be sterilized. Okay. So just points there. And the first point we're going to do is called large intestine 4.
Okay.
Now each of these points also have a name, but for simplicity's sake, we're just going to use the numbers. Okay. So you might feel a slight prick or a slight sting.
Sensation from the needle?
Yep. So this point is a great point for expelling exterior symptoms. So for example, if you feel a cold coming on, you might feel fever, chills, sore throat. This is a great point to treat the acute stages or the early stages.
And this is the large intestine channel, and it runs to the head, doesn't it?
Yes.
Does not?
So it goes up the arm, up the shoulder, up the neck, and then ends on the face near the nose.
So is it also good then for like frontal lobe headaches?
Yes, frontal lobe headaches, and also anything to do with the eyes, the ears, the nose, and the mouth.
Okay.
So like nasal congestion, toothache.
So this is great for cold season?
Yes, that's a great point. It's also great for calming the mind too. If you maybe get anxiety or agitated easily, this is a great point for that.
Well, normally when I get acupuncture done, I mean, I'm lying down on a table, and for me, it induces the relaxation response, and I fall asleep. So I'm hoping I don't fall asleep right now, because it's not good if the host falls asleep.
We'll stimulate the nerves a bit.
But if I do, here's a note, so the show's all yours.
Okay.
Okay, so what's this point?
So the next point is called triple warmer 5, or San Jiao, or triple burner.
Yep.
Again, like large intestine 4, this helps expel the exterior, and it's also great for any channel pain or meridian pain. So again, this goes up the arm, up to the back of the shoulder, and ends around the ear. Okay. So it's also great for any ear problems, like ear infections, earaches, and that sort of thing.
I'm feeling a lot of sensation around this large intestine 4 area. Like it's really intense, like almost like eating a jalapeno pepper. That's how intense it is.
You might feel, the heaviness or a dull, aching sensation, right? Yeah, that's a good
lot
sensation.
of energy moving, and I am feeling some energy trickling up this way.
Yes, you might feel like kind of like a tingling or even that electric sensation. Okay, so if you'd like to relax your arm a bit.
Sure.
So this last point is called large intestine 11. So this one does connect to the one on the hand because it's on the same channel.
Okay, so it's on the same channel as this one.
Yes, same
so
channel, so it goes up like this. Okay. And so this one's also great for expelling heat, more particularly.
What's heat?
Heat, so like it manifests in symptoms such as fever, extreme thirst, maybe even inflammation. So this would help draw out some of that heat from the body.
Okay.
Okay.
So pain, right?
Pain, pain for the elbow, pain on the shoulder.
This is tennis elbow.
Yes, this is a great point for that. And it's actually really a good point for cooling the blood. So that
What does that mean? Because I know in Chinese medicine, I mean, you guys have your own terminology in terms of things being dry, or there's wind, or heat, or cold.
Yes. So heat in the blood is really heat in the blood level, we say. And so that would manifest in a lot of skin conditions. So like psoriasis or eczema, we can say it is heat in the blood because you get the redness, the itchiness, the swelling sometimes, dry skin.
Wow, it's just really coming up to my neck. I love it. I love it.
So what we can do is actually stimulate this.
Yeah.
Okay. So like you mentioned the sensation here. Okay, we call that the de qi sensation. It's a heaviness. De qi. Yeah, it's a heaviness or a numbness, achy sensation, and that's a good sensation. We want to obtain that with every needle. And once we've obtained that, we can actually manipulate the qi.
Yeah, like there's certain things that you can do with the needles. Like there's definitely, I mean, a host of needling techniques, right? Like if I flick it, what does that do?
So that might help disperse the qi a bit.
Okay.
From that area.
Like disperse the stagnated qi, and maybe like promote the arrival of vital qi.
Yes.
Like it's a 2-in-1?
You can say it like that. It also helps spread the qi from that area.
Okay.
So for example, let's say we've put this needle in, but we want the needle to go up, or the qi to go up. So we can twirl, that's one of our techniques, like so. We can do the flicking.
So you're driving the energy.
Yes.
Right.
And then what we can also do is tap, like that. And you'll feel eventually, because the qi has come here, when you're tapping, it starts to go up the channel. And that's how we can direct the qi or manipulate the qi.
Interesting. So how many, there's what, 12 primary meridians that are associated with the organs?
Yes, there's 12
Do you want to talk about those? And we're going to post up an acupuncture model so people can actually see the intricate design of the meridian anatomy. And you're going to talk about the meridian lines. I mean, how many do I have in my hand?
So on the arms, there's actually 6.
Okay.
So right now we already had the large intestine, the sanjiao, and on here we have the small intestine. And on the other side of the arm, we have the lung, the pericardium, and the heart meridians. Okay. Okay, on the leg, we also have 6. So on the inside of the leg, we have the liver, the kidney, and the spleen meridians. And on the outside of the leg, we have the stomach, gallbladder, and urinary bladder meridians.
So the points are a way to access the meridians, and the meridians access the internal organs.
Yes.
Right? So acupuncture is about balancing the meridians, so you're balancing also your internal organs.
Balancing the energies of the
energies
organs.
of that. Now, you know, clearly when someone comes to see you, you're not going to needle them right away. You're going to probably do, I would imagine, like an intake process.
Yes,
okay,
that's right.
So describe to me what that procedure looks like in Chinese medicine.
Okay, so our diagnostic methods begin first with observation. Okay. So the minute the person walks into our office, we're already starting our diagnosis. So we're observing their body language, their posture, their demeanor, maybe any physical features that are significant. For example, do they have a red face that day? Do they have swelling on the neck? Maybe it's a young person with very thinning hair. Those are all indications to us of what can possibly be going on in that person's body. And so after that, we go through a comprehensive health history where we ask questions to get a better understanding of their lifestyle and dietary habits and also health habits in general. Okay, so we ask questions about sleep and appetite and bowel movements and even emotions, because all of that ties in with health. And so after that, we do the tongue and pulse.
Yeah, and that's what's popular in Chinese medicine, the tongue. I'm not going to stick out my tongue, so don't ask me to. But describe why the tongue is important in diagnostics.
The tongue actually reflects the whole body in general. So we're looking at not only the organs, because the organs are reflected in different areas of the tongue. We're also looking at the coating of the tongue.
Like if it's white or greasy?
Yeah, sometimes you notice people have a thick coating on their tongue, and that can represent something we call dampness in the body, or phlegm in the body. And we also look at the shape of the tongue. So is it a big swollen tongue? Is it a thin, small tongue? And we also look at the moisture level. Is it a very dry tongue? Is it a very wet tongue? And each of those represents something different in Chinese medicine.
Okay. What about teeth marks?
Yep, teeth marks too.
Okay. So you look at the tongue, and then what about pulse? You guys do it differently than Western medicine.
Yes.
Okay.
So the pulse.
So show me what you do for pulse.
Okay. So the pulse,
that out of the way.
like the tongue, also represents different organs.
Okay.
So on the right side, and we take the pulse on the thumb side of the wrist. Okay. On the right side here, we have the lung, the spleen, and the kidneys. Yeah. And on the left side here, we have the heart, the liver, and the kidneys.
So just by feeling those different areas on the pulse, you're able to get an idea of what the energy is or isn't like in that particular organ. Like if you're putting your hand on the kidney, you can get a sense of whether it's deficient in energy or has an excess of energy. Is that correct?
Because we're looking at the strength of the pulse as well as the shape and the quality of the pulse. So depending on if it's, for example, if it's a strong pulse, we say that that person's qi and blood is stronger. If it's a small, thin pulse, it's very hard to feel, we say that that person's qi and blood is a little weaker.
Interesting. So from all that, it sounds to me like a very holistic approach to diagnosing a person. And obviously everyone's individual when they come and see you. And then from there, you determine really what your diagnosis is, and then your treatment, where you're going to put the needles in. Now, how long do these needles stay in a person?
Typically, needles would stay in between 20 to 40 minutes, depending on the person and depending on the condition they've come for.
And you come in and out and twirl and flick and do all types of needling techniques?
Because we want to maintain that de qi sensation.
The de qi. The qi is, see, this one feels like it's hard to move because, and that means, if I'm correct, the qi is actually grabbing the needle right now. So in people who are weak, it's very hard for the qi, or it takes a longer time for the qi to grab the needle. Like, see, this one's very erect.
Yes. And that's fine.
The qi's there. I can feel it there.
Right. And then if I'm even to pull it slightly, it won't move. And that's indicating that the qi has really grasped onto the needle and it's doing its work.
So in terms of pain, I mean, I love this approach because, one, it's drug-free. And it's really balancing your energy system. So this helps with knee pain, back pain.
Yep, it helps with all sorts of pains. But first we have to consider what is the root cause of the pain. So it can be caused from a deficiency, or it can be caused from an excess, such as an obstruction of the meridians. And so we first determine that before we can determine how to approach treating the pain. So for example, if it's...
Okay, yeah, no problem. So we're going to come to the end of the segment.
Okay.
So we got to take the needles out.
Okay.
I'd love to have them in longer.
Let me take them out.
But we'll take them out. And what about Chinese herbs in pain? How does that work?
Okay, herbs and food therapy actually play a big role in pain because it can help balance the energies of the bodies and provide nourishment to the body if that's the cause of the pain. So for example, if it's a kidney deficiency causing pain, we could add herbs to help boost the kidney energy strength, and now help support the lower back, for example, if that's the pain, and then we treat the pain that way.
Wow, you know what? It actually feels really relaxed. Just in that short period of time, it feels like very heavy.
Yes.
And now this one's off.
Yes.
So I'm gonna have to come to you and get needled afterwards.
Sure.
Just back to herbs for a minute. Ginger's popular.
Yes.
Yeah.
Ginger is actually a great Chinese herb. It helps warm the body because it's such a hot herb. So if you had yang deficiency, we say, manifesting in like cold limbs or cold sensations, we would recommend ginger to help bring warmth to the body and help circulate the qi to the extremities.
Okay, and you supervise a student clinic at the Ontario College of Traditional Chinese Medicine?
Yes, I supervise a student acupuncture clinic, and we have treatments there that you can come and get for $10. So that's a
wonderful. And do you have a phone number?
Yes, it's at 905-604-8855.
Stephanie, thank you so much.
Thank you so much, Dr. Lana,
for being here
having me.
teaching us about acupuncture.